ACL, or Anterior Cruciate Ligament, surgery is a common procedure performed to reconstruct a torn ACL in the knee. Here's an overview of what ACL surgery entails, the recovery process, and what to expect. Before surgery diagnosis, your orthopedic surgeon will conduct a physical examination, review your medical history, and likely perform imaging tests like an MRI to confirm the ACL tear. Preparation. Before surgery, you may need to undergo pre-operative tests and evaluations. Your surgeon will also discuss the procedure, risks, benefits, and post-operative expectations with you. During surgery procedure, ACL reconstruction surgery is typically performed arthroscopically, where small incisions are made around the knee. The torn ACL is removed and a graft, often from your own hamstring tendon, patellar tendon, or donor tissue, is used to reconstruct the ACL. Anesthesia, you'll be under either general anesthesia, where you're asleep, or regional anesthesia, where only the lower body is numbed. After surgery recovery room. After surgery, you'll spend time in a recovery room where your vital signs will be monitored as the anesthesia wears off. Post-operative care, pain management. You'll receive pain medications to manage discomfort. Physical therapy. Physical therapy usually starts soon after surgery to regain knee strength, range of motion, and stability. Brace and crutches. You may be provided with a knee brace and crutches to support and protect your knee during the initial recovery phase. Rehabilitation and recovery. Early phase, which spans weeks 1 to 6, focuses on reducing swelling, regaining knee range of motion, and beginning gentle exercises to strengthen the knee. In the intermediate phase, from weeks 6 to 12, you will continue with physical therapy to improve strength, balance, and stability. Gradually, the intensity of exercises will increase. The advanced phase, which covers months 3 to 6, introduces more challenging exercises and activities to improve agility, coordination, and prepare for a return to sports or physical activities. For long-term recovery, your surgeon and physical therapist will guide your return to sports or activities based on your progress and recovery milestones. Regular follow-up appointments with your surgeon will monitor your knee's healing and function. Risks and complications. Infection, though rare, can occur post-surgery. There is a small risk of developing blood clots in the leg, known as deep vein thrombosis, or in the lungs, called pulmonary embolism. Sometimes the graft may not heal properly or may re-tear. Additionally, some patients may experience persistent knee stiffness or pain. Success rate. ACL surgery has a high success rate in restoring stability and function to the knee, particularly when coupled with comprehensive rehabilitation. However, individual outcomes can vary based on factors such as age, activity level, and adherence to rehabilitation protocols. Conclusion. If you're considering ACL surgery or have already undergone the procedure, it's crucial to follow your surgeon and physical therapist's guidance closely throughout the recovery process. Patience and commitment to rehabilitation are key to achieving optimal outcomes and returning to your desired level of activity safely. Always consult with your healthcare provider for personalized advice and care.